Hi again, everyone. It's Dr. Mike. We're back here for tip number 34 in our MET101 ebook series. Now, please go over to MET101ebook.com, download your free copy. I think these 101 tips, which are based on questions and answers we've given over the last 30 years, may be helpful for you in building a practice, whether you are a medical exercise professional, maybe even you're a physical therapist or physical therapy assistant who's dabbling in the area of medical exercise training with offering this in your facility or maybe after hours. I think it may be helpful for you. So, tip number 34. What habits do successful MET professionals demonstrate? Now, folks, years ago, I read Stephen Covey's book, The Habits of Highly Successful Professionals. And Mr. Covey, I believe, has passed on at this point, so we obviously respect the great work that he did. But with that, I kind of took that concept and applied it now to medical exercise professionals. So if you would allow me to read this. Well, it's interesting. I actually wrote an article on the 8 habits of highly successful MET professionals, or medical exercise training professionals. I found there are 8 habits our most successful medical exercise professionals around the world possess. And we did talk to MESs on 3 continents around the world with regard to what made them successful. And this is what we got. These individuals have these 8 habits in common, and these habits seem to make a real difference, a huge difference, in their ability to build a successful and profitable MET practice. If you are able to incorporate these 8 habits into your practice, you will find unlimited success and have a profitable MET program. These habits are really easy to incorporate into your professional and personal lives. These habits include the following. Now, I beg you and highly recommend that you get Stephen Covey's book. Number 1, or A, the medical exercise professionals defines who he is to medical professionals and MET clients. Folks, a lot of us want to just simply use our certification title to define who we are. That doesn't work that way. And folks, I'll be honest with you. We did the very first medical exercise specialist workshop back in 1994. The idea wasn't the title that you would get. The idea was the ability, the skills and knowledge that you got to produce an outcome for a client. So, letter B. The successful medical exercise training professional MET will report. He or she reports their findings in an effective manner and format to doctors, therapists, chiropractors, and even insurance carriers. Folks, we find a lot of our medical exercise specialists nowadays do not document anything they've done. They don't send reports to doctors, therapists, or chiropractors, and Lord forbid they ever have an insurance claim. They certainly are going to lose out on that because they don't document anything. You've got to document and report. C, the successful medical exercise professional follows up. This means the follow-up includes on phone calls, emails, faxes, and situations that occur with the client. So the client asks a question or something is not going appropriately in the exercise program, the MET professional will contact the doctor, the therapist, or the chiropractor in a follow-up method or a follow-up mode. This becomes important. You can't just let things go. You got to stay on top of things to make sure you're providing the best medical exercise training services to your client, and that helps them produce the best outcome. And remember, you're not a primary provider of health and wellness services, but you certainly are a tertiary provider, so you need to follow up with the doctor, therapist, or chiropractor. Letter D here. Successful medical exercise professionals assess. Okay, that means they assess and reassess the client and continually ensure the client is making progress toward the program goals. Folks, an assessment could simply be, Mr. Smith, how you doing today? How did you do over the weekend? How did you do with your gardening? Take that information, and when they give you their feedback, it should give you an idea of how well the client is able to function, what muscles, what joints are moving well or functioning well. So you have to be able to take this information and visualize it in your head to apply to your client. Letter E, the MET professional progresses clients. They progress the client through their short-term and long-term goals. Folks, you can't have clients that just stagnate. Now, I know some of you want to keep clients forever and ever and ever, and I get that. But once a client is plateaued and they're at a certain point, they're not a medical exercise training client anymore. Maybe they're a personal training client, but the medical exercise training client is always moving forward with new goals, functional goals. And once they plateau, now we can step them down to personal training because it doesn't require as much thought medically on your part or your medical exercise training to now work with that client as a personal training client to maintain the gains you made. Letter F, the medical exercise professional that's successful motivates his clients. He or she motivates them to work through their discomfort and their pain appropriately. This keeps them motivated so they'll keep coming back. He keeps them focused on the ultimate goal of improving their level of function. Now, we also have to be careful. We have a pain scale. That 1 to 10 pain scale, when they're getting up in that realm around a 6 or more, we definitely need to refer them back. But when they're at that 4 level, maybe we need to modify the exercise. Letter G, the medical exercise professional presents to medical professionals, professional organizations, local support groups, and more to inform these groups on the benefits of medical exercise training in managing medical conditions. Folks, this is a must. If we want our profession to thrive and grow, you've got to get out there and present professionally, dress professionally, and have professional topics you will discuss that relate to that individual sitting in that meeting. They can take that away and realize when they are in need of your services, you have presented professionally, so they'll come back to you. And then H, lastly, the successful MET professional educates his clients and the medical community as well as the community at large. He educates his or her clients on the importance of exercise and wellness in their lifestyles, particularly with individual conditions. He educates the medical community with regard to the services he or she is able to offer, his or her scope of practice, and his or her role in working with medical professionals and managing their clients with medical conditions utilizing exercise. He educates members of the community on the benefits of medical exercise services and how these services can function and enhance wellness. Now, folks, those are 8 pretty important skills or habits. And I know all of you have the ability to do it. It just takes being more deliberate, being more intentional, and saying, I'm going to provide professional services. I'm going to establish a relationship in this community as being a high level medical exercise professional. And folks, it's not difficult, but it does take intention. So please, if you would, go over to MET101ebook.com, download your free copy. And if you have questions for me, email me at drmike@postrehab.com. Take care. Thank you.